The emergency call was placed at 21:24 Central Standard Time. The 9/11 recording, later entered into evidence, captured a woman's voice fractured by panic. "He's not breathing right. Danny gave him the wrong pill, please send someone now." The dispatcher flagged it as pediatric respiratory failure. Units were dispatched to 1449, Wilson Creek Road, a single-level residence on the eastern edge of Fulton, in Callaway County. When paramedics arrived at 2131, they found the child unconscious on the living room floor, pulseless and cyanotic. The father was kneeling over the body, attempting compressions but demonstrating incorrect technique. The mother was inconsolable, crouched against the hallway wall, repeating, "I told him it wasn't in the bathroom," over and over. Events had unfolded in less than 45 minutes. Earlier that evening, Daniel Carter had returned home from his 10-hour shift at Central Welding Systems. His wife, Rachel, a licensed practical nurse, had just finished her second consecutive double shift at Rolling Meadows Nursing Center. They had traded exhaustion like a baton. Their son, Jonathan, had started to complain of chills and mild stomach discomfort shortly after 7 p.m. Rachel gave him orange juice and a cool compress, then lay down in the master bedroom with a headache. Daniel, attempting to take over care for the night, noticed his son's forehead was warm and guessed a low-grade fever. At approximately 20:50, Daniel went to the master bathroom, opened the mirrored cabinet, and retrieved a small, brown glass bottle with a white, semi-torn label. The bottle had no child safety cap. Its label bore a pharmacy imprint almost entirely erased from age and handling. He shook out a single pill, white and round, and crushed it with the back of a spoon into a glass of tap water. Jonathan drank the mixture willingly. Within 10 minutes, he became unusually quiet. Within 15, he began slurring his words, then fell asleep so quickly Daniel assumed the medication had worked. At 21:15, Rachel entered the living room and immediately sensed something was wrong. Her son's skin was cool and his lips were blue. He was unresponsive to touch and voice. She rolled him onto his side and began CPR while Daniel called 911. At no point during the call or immediate aftermath did Daniel mention the specific pill he had administered. He believed it to be acetaminophen. Emergency medical services recorded initial vitals: no pulse, no respiration, pupils fixed and dilated. The child was intubated and transported to Callaway County Hospital, arriving at 21:56. Despite resuscitation efforts, Jonathan was declared dead at 22:06. Hospital toxicology screens returned results at 1:40 the next morning. Jonathan's blood contained 370 nanograms per milliliter of nortriptyline, a tricyclic antidepressant contraindicated for pediatric use due to its narrow therapeutic index and high cardiotoxicity in overdose. Toxicology classified the dose as acute fatal ingestion. Rachel Carter, upon learning the drug name, identified the bottle as her own, originally prescribed in March 1987 following postpartum depression. She believed she had discarded it years earlier. Investigators later found it had been moved into the shared cabinet during a household reorganization the previous autumn. It had remained there, unmarked and indistinct, ever since. Daniel Carter, in a sworn statement to responding deputies, said, "I just wanted to help him sleep. I didn't know it was anything dangerous." His tone was described as vacant, shocked. He volunteered the crushed pill and glass as evidence. Both tested positive for nortriptyline residue. At the time of this report, no criminal charges had been filed. The confirmation of death was issued at 22:06 Central Standard Time by Dr. Eleanor Brandt, emergency attending physician at Callaway County Hospital. Cause of death was provisionally recorded as cardiopulmonary arrest, suspected toxic ingestion, pending toxicology. Hospital staff noted that the father, Daniel Carter, remained standing at the end of the gurney throughout resuscitation attempts, unmoving, his hands still bloodied from earlier chest compressions. When Dr. Brandt informed the parents of the fatal outcome, Daniel did not respond verbally. Rachel collapsed to the floor. According to nurse assistant Carla Mendoza, who was on shift in Trauma Room B, Rachel Carter began to sob violently, repeating, I told him. I told him it was in the kitchen drawer. A physician attempted to guide her to a quiet room, but she refused to leave Jonathan's body. Daniel sat down in a nearby plastic chair and did not move for 27 minutes. Witnesses noted that his breathing was shallow and irregular. When asked if he needed water or medication, he did not respond. Hospital security contacted the Callaway County Sheriff's Department at 22:34 hours to request official notification and potential involvement due to the suspected accidental poisoning of a minor. Deputy Richard Combs arrived at 22:56. He entered Trauma B and began preliminary inquiry. Daniel identified himself, gave consent for his clothing to be taken for evidence, and repeated his earlier account: 1 pill, crushed in water, retrieved from the bathroom cabinet, back row, little brown bottle. He added, "I thought it was Tylenol, the kind for kids." Rachel Carter was escorted to a private examination room for shock evaluation. Hospital notes indicate she exhibited symptoms of acute emotional distress, hyperventilation, tachycardia, resting pulse 122 bpm, intermittent dissociation, and short-term memory lapses. When asked by a crisis counselor if she blamed her husband, Rachel reportedly answered, "I don't know. I just know my son is dead and I didn't get to say goodbye." At 0:17 Central Standard Time, investigators returned to the Carter residence with a signed consent form authorizing a search. The brown bottle in question was collected from the bathroom cabinet, labeled only with remnants of a once-adhered pharmacy sticker. The text, nortriptyline HCl 50 mg, take 1 daily, was still faintly visible under angled lighting. The expiration date showed Mar 89. The contents included 3 full tablets and 1 partial. Officers also collected a nearly full bottle of children's acetaminophen syrup from a kitchen drawer adjacent to the refrigerator. Rachel later confirmed that was the correct and current medication used for Jonathan's previous fevers. At 2:06 Central Standard Time, Daniel Carter underwent voluntary questioning at the sheriff's office. The session lasted 42 minutes. No legal counsel was present. Daniel, described by Detective S. Holcomb as detached and slow to respond, reiterated the same account without deviation. He became emotionally distraught only once, when asked to describe Jonathan's last words. He said he was sleepy, and that he'd feel better after cartoons. The sheriff's office concluded its initial fact-finding interview at 2:48. Daniel was released into the care of his brother, Ronald Carter, who had arrived from nearby Holt Summit. Rachel remained at the hospital overnight. At 4:30 Central Standard Time, the Callaway County coroner officially classified the death as accidental pending final toxicology. No immediate charges were filed. Following the official classification of death as accidental by the Callaway County Coroner's Office at 4:30 Central Standard Time on February 20, 1991, Daniel and Rachel Carter were released into private care. The family residence was secured and sealed until the following afternoon, when sheriff's deputies completed a secondary walkthrough and cleared the premises for re-entry at 14:40 Central Standard Time. Rachel Carter did not return home. According to hospital records and witness accounts, she remained in a temporary care wing at Callaway County Hospital for an additional 48 hours under psychological observation. Staff attending to her described prolonged, unrelieved grief. Social worker Marla Jennings recorded the following statement during a bedside session at 11:22 Central Standard Time, February 21. "I was gone all day. I told Danny the Tylenol was in the kitchen. He doesn't look at labels. He thinks everything is fine if it's in the medicine cabinet. I don't know why I didn't check before I lay down. I should have checked. I should have heard something." She declined food for the first 24 hours, drinking only small amounts of water. Nursing notes indicate intermittent crying through the night, often waking other patients. When asked if she wanted to speak to her husband, Rachel answered, "Not yet. I need to bury my son first." Daniel Carter returned to the family home under the care of his brother Ronald, a registered HVAC technician. The home's interior was noted to be clean and orderly. Jonathan's bedroom, decorated with space shuttle posters and a twin bed covered in a Star Wars comforter, had been left untouched. Ronald later told investigators that Daniel refused to enter the room. He spent both nights in the living room, sleeping intermittently on the couch, dressed in the same clothes worn at the hospital. Neighbors reported no sound from the residence other than a single incident at 2:10 a.m. on February 21. A nearby resident described hearing what they believed to be shouting or crying, followed by silence. When asked by Deputy Combs during a follow-up visit about this disturbance, Daniel stated, "I tried to wake myself up from it. I kept dreaming I gave him 2 pills instead of 1. Rachel arranged the funeral through Halstead Memorial Home in Fulton. Jonathan's body was released on February 22. The viewing was held at 10 a.m. on February 23, with the casket closed per Rachel's request. Attendance included extended family, co-workers from the nursing home, teachers from Jonathan's kindergarten class, and 2 uniformed officers from the Callaway County Sheriff's Department. Daniel was present but largely unresponsive to visitors, sitting in the second row beside Ronald, his posture slouched and his hands unmoving. Eyewitnesses at the service noted the physical separation between Rachel and Daniel. She sat flanked by her sister and mother, never looking in his direction. When Rachel gave a brief eulogy, she referred to her husband only once, saying, "Jonathan loved his daddy. He believed in him. That's why he drank what he was given." Following the burial at Woodlawn Cemetery, Daniel left early and returned home alone. Rachel returned to her sister's residence in Mexico, Missouri. By the evening of February 23, the couple had not spoken since the night of their son's death. In the week following Jonathan Carter's funeral, legal attention shifted from the immediate trauma to procedural review. Though initially deemed accidental, the nature of the death, involving a Schedule IV psychotropic agent administered by a non-medical guardian, required statutory evaluation for potential criminal negligence or endangerment. On February 24, 1991, DFS received a mandated referral from the sheriff's office. Though no other children resided in the Carter household, the presence of unsecured medication in proximity to a minor triggered a child fatality protocol. DFS assigned investigator Stephanie Klein to the case. Her report, submitted March 2, concluded. The fatal incident resulted from a convergence of poor storage practices, misidentification of medication, and absence of critical parental oversight. No indicators of systemic abuse were found. Emotional trauma to surviving parents is acute. Recommendation: no additional DFS action warranted. Refer to prosecutor's office for legal review. Parallel to the DFS inquiry, Detective S. Holcomb of the Callaway County Sheriff's Department conducted a full evidentiary audit. This included chain of custody validation for the recovered nortriptyline bottle and the mixing glass. Witness affidavits from Rachel Carter, Ronald Carter, and neighbors. A complete history of Daniel Carter's prior interactions with law enforcement, no previous arrests or disciplinary records noted. Toxicological validation confirming Jonathan's serum nortriptyline level exceeded the median fatal dose by a factor of 2.4. The investigative team submitted a final report on March 5, 1991, recommending review by the county prosecutor for possible involuntary manslaughter or criminal negligence charges. Notably, the report cited Daniel Carter's failure to verify the medication type or dosage despite the clear absence of a childproof cap or readable label. While no malicious intent was evident, investigators flagged the action as grossly reckless under the standard expected of a caregiver. Callaway County Prosecutor Donald L. Rem received the full case file on March 7. After reviewing forensic, witness, and procedural material, Rem convened a preliminary grand jury session on March 11. Testimony was heard from Rachel Carter, under subpoena, lead investigator Holcomb, and Dr. Eleanor Brandt, emergency attending. During closed-door testimony, Rachel Carter was asked if her husband had ever previously administered medication incorrectly. She responded, "Not that I can remember. He didn't know names of most of the pills. I used to say, just let me handle it. But I was tired. He wanted to help. The jury deliberated for 90 minutes and returned a no bill, declining to indict Daniel Carter on any criminal charge. The decision was based on lack of intent and the belief that a reasonable person, under stress and without medical training, could have made the same error. Daniel Carter was formally cleared of criminal liability on March 12, 1991. Following the grand jury's decision not to indict, Daniel Carter returned to public life in a subdued, diminished capacity. He resumed part-time work at Central Welding Systems on March 25, assigned to warehouse inventory rather than production floor duties. Co-workers later reported he rarely spoke unless prompted and frequently arrived late or left early with no explanation. Rachel Carter did not return to the family residence. She remained at her sister's home in Mexico, Missouri, working reduced hours at a local hospice. In conversations with family, she referred to the house on Wilson Creek Road as a place I can't go back to. Though legally still married, she initiated an informal separation in April, telling her employer she was figuring out how to start from scratch. Mail addressed to Daniel was forwarded, joint finances were quietly dissolved. Attempts by Daniel to contact Rachel during this period were infrequent and unsuccessful. According to a statement later made by her sister, Rachel received 3 handwritten letters between March and May. She opened only one. In it, Daniel had written, "I know you don't want to see me. I understand why. But I can't stop seeing him when I close my eyes. I think you must see the same thing. I don't know how we're supposed to live through this." Rachel never responded. A grief counselor from the hospital, Janine Lowe, contacted both parents independently. She held one session with Rachel in early April and documented guilt displacement consistent with traumatic bereavement. Rachel stated she had forgiven Daniel, on paper, but not in her heart. "If it was an accident," she said, "why do I still feel like it was a betrayal?" Daniel declined counseling. When contacted, he said, "I have to live with it every day. What could a stranger say to me that I haven't said to myself already?" The home remained unchanged. Jonathan's bedroom was never cleared. The toys remained arranged, untouched. Neighbors described Daniel mowing the lawn in silence, never speaking unless required. One resident, Diane Harrelson, noted, "He looked like a man waiting to be punished, but no one ever showed up to do it." By June 1991, Rachel filed for legal separation through a county mediator. She did not request alimony or division of assets. Her only stipulation was that the house be sold and proceeds placed in a child health foundation under Jonathan's name. The formal separation between Daniel and Rachel Carter was finalized in August 1991 without contest. The Wilson Creek Road residence, once intended as a long-term family home, was listed for sale in September and entered escrow the following spring. Daniel moved into a one-bedroom rental apartment off 5th Street in Fulton. Rachel, by then residing full-time in Mexico, Missouri, declined to be informed of the sale's finalization. Public interest in the case had waned, though it remained a subject of quiet conversation in the community. At the First Baptist Church, where the Carters had occasionally attended services, the Sunday school wall still bore a framed photograph of Jonathan, smiling, with the caption, "He sang loud and loved dinosaurs." Daniel stopped attending altogether. In October 1991, Rachel Carter established the Jonathan M. Carter Fund for Pediatric Safety, a small nonprofit initiative aimed at promoting safe storage and disposal of prescription medications in homes with children. The fund launched with a modest donation pool drawn from the proceeds of the home sale and local sponsorships. Working with public libraries, clinics, and school nurses, the program distributed pamphlets, lock boxes, and offered disposal services for expired medications. Rachel did not attach her full name to the project literature. She signed communications as JMC's mother. Daniel made no public statements regarding the fund. At Central Welding, Daniel remained employed but demoted. Supervisors noted persistent absenteeism and minor errors. He was placed on medical leave in December 1991 after a back injury and did not return. According to county employment records, he received short-term disability through early 1992, then transitioned to supplemental income via part-time delivery driving for a local hardware distributor. His apartment was modest. No television. No phone line. Photographs of Jonathan, 3 framed and 1 taped to the refrigerator, were the only visible decorations. A neighbor, Lorraine Packard, described him as a quiet man who looked like something important had broken inside him. On March 10, 1993, 2 years after his son's death, Daniel Carter was hospitalized after a self-inflicted wrist laceration. He was treated at Callaway County Hospital, the same facility where Jonathan had been pronounced dead. A suicide note was found in his apartment. "I don't want to keep waking up. I've done everything wrong. I miss him and I don't know what to do with the rest of my life." He was placed on a 72-hour psychiatric hold under Missouri Revised Statutes, Section 632.305. No criminal charges were filed. Following Daniel Carter's psychiatric hold and brief inpatient treatment at Fulton State Hospital in March 1993, he was released under outpatient supervision. According to his assigned caseworker, Daniel declined further counseling after 2 sessions, stating, "I didn't come here to feel better. I came here because I didn't know where else to go." He relocated shortly thereafter to Hannibal, Missouri, working night shifts stocking inventory at a wholesale distribution center. He rented a basement apartment, paid in cash, and kept minimal contact with relatives. Ronald Carter, his brother, visited occasionally. In a 1997 written statement for a state inquest into suicide prevention programs, Ronald noted, "He never forgave himself. He never asked anyone else to." Rachel Carter remained in Mexico, Missouri. Her nonprofit, the Jonathan M. Carter Fund, continued modest operations through 1996, by which point it had distributed over 4,000 medication lockboxes across Callaway, Audrain, and Boone counties. In 1995, she testified before a Missouri State Health Committee advocating for mandatory labeling and expiration removal guidelines for prescription drugs stored in homes with minors. Her appearance received limited media coverage but prompted internal policy changes within 2 regional hospital systems. Rachel never remarried. In personal correspondence obtained from the fund's archives, she wrote in 1998, "I learned that grief can be shaped into something useful. But you never get it all out. It settles in places you don't expect. And it waits." Daniel Carter died on August 3, 1999, from complications related to untreated hypertension and alcohol-related liver disease. He was 43 years old. No obituary was published. His body was cremated, the ashes were collected by Ronald. Among Daniel's effects was a folder labeled JMC, containing drawings by Jonathan, photographs, and 2 letters, one unopened, addressed to Rachel, postmarked 1993. Rachel did not attend Daniel's death hearing or claim any personal effects. When contacted by the county coroner for final disposition approval, she responded, "Handle it however's easiest. We're both gone already." In 2001, the Missouri Department of Health cited the Jonathan M. Carter case as an example in its statewide Safe Storage Saves Lives campaign, which launched the first coordinated household medication take-back program in the state. Though Rachel had dissolved the original nonprofit by that point, the initiative bore her son's name in its earliest literature. The Carter case remains closed, not by resolution, but by time.